So in terms of antibiotic pharmacokinetics and pharmacodynamics, we're beginning to understand that there's a wide variation between individual patients and that this is leading to suboptimal outcomes in certain populations. One of the major barriers at the moment to being more individualised in how we optimise antibiotic therapy is the ability to be able to monitor in real time the changes in an individual antibiotic's pharmacokinetics within a patient. So the rationale behind use of microneedle technology is that it allows us to have a direct in vivo measure of continuously changes in pharmacokinetics over time. So in terms of microneedle-based sensing, it's not limited to any one class of drug, and in fact you can also monitor biomarkers or metabolites through it, such as lactate and glucose, which there's already good evidence for. In terms of the sensor that was reported here, we used a beta-lactamase enzyme, which means it is limited to penicillins. However, there are other different types of sensing mechanisms that are quite easily translated onto microneedles to allow you, for example, to sense aminoglycosides, which has already been demonstrated, as well as other agents such as colistin or antifungal agents. So I think we're beginning to see more and more evidence now to suggest the role of being able to individualize antibiotic dosing. And one way that we've tried to sort of optimize therapeutic success whilst minimizing harmful consequences of therapy, so development of resistance or development of toxicity for our patients, is through the use of changing the rates of infusions, for example, so intermittent and continuous infusions in sepsis. So one example is, rather than just giving an infusion and hoping that it achieves an appropriate level to optimize outcomes, minimize harmful effects, what we can do is use these needles and the sensors to actually change that rate of infusion to make sure that we give just enough antibiotics for the optimal outcome, but make sure that we don't overuse antibiotics to try and ensure we can utilize and prolong the use of those agents also.